Injections for knee arthritis: steroid, PRP, and gel. Let's talk about it. Knee steroid injection. So when we do the knee steroid injection, we inject it into the joint space. So this here is a model of the knee. Here will be the cartilage. Here's the thigh bone, shin bone is down here. That's the kneecap. So when we do the injection goes into this space right here and floods this area. So when you have our knee arthritis, there's wear and tear of the cartilage, and of course there's inflammation in the area. So when you inject the steroid in there and it washes the area, what it does, it helps to bring down the inflammation within that area, and that is why you tend to get a very rapid relief in the knee pain. Then you do a knee steroid shot, then you can put yourself in a danger zone. Now, if you have diabetes or pressure and it's well controlled, then you can safely do the knee steroid shot. So as with any injection, when you do the knee steroid, I highly recommend that you lose weight if you need to lose weight, and do therapy to strengthen the muscles that support the knee joint. And sometimes you may actually need to wear a knee brace as well to further support the knee. Other people may actually need to wear medical insoles to help to realign the feet, because if the foot is rotated inward or outward, that can also lead to an exacerbation of the knee pain. So when dealing with knee pain, it's not just about the knee alone. You have to think a bit lower down and even higher up as well. If you have certain spinal misalignments that are causing one hip to be higher or lower than the other, then that could also potentially lead to knee pains as well as knee arthritis, or exacerbate the pain of the existing knee arthritis. So again, when you're dealing with the knee pain or knee arthritis, it's not just about the knee. Think a bit higher up and think a bit lower down as well. PRP for knee arthritis. So this here is a model of the knee. This here will be the cartilage within the knee joint. We also have cartilage on this surface and this surface. This is the thigh bone, shin bone here. That's the kneecap. So the ligaments that support the knee joint as well. So when you have arthritis and wear and tear of the cartilage, what can also be done is the PRP shot. Now the PRP shot, that is when we draw out your own blood, about 10 mL of your own blood from one of the veins, and we put it into a test tube like this here. Then this is put into a centrifuge that is going to spin and it's going to separate the red blood cells from the plasma. Now the plasma part, that is what is taken up into the syringe, and then that is injected into the knee joint. Now this plasma here has a lot of growth factors. When that is put into the knee joint and floods the area, the growth factors tend to help with some repair of the cartilage. Not 100% repair, but there is some repair. And one of the requirements for the PRP is that you must still have some degree of cartilage within the knee joint. If it's a bone-on-bone situation where the cartilage is totally would run away, you have bone rubbing on bone, I do not recommend the PRP in that particular situation. Now, with the PRP, typically it is a course of 3 shots, and each shot is done 1 to 4 weeks apart. Now, with any injection, we always recommend therapy for the knee to strengthen the knee. If you're overweight, lose weight, as well as you may need to wear a knee brace to support the knee. If your foot is rotated inward or outward, you may need to wear the proper insoles to realign the foot to take some pressure off the knee. If you have scoliosis, any misalignment of the pelvis, one hip higher than the other. These mechanical factors can also lead to the exacerbation of the knee arthritis pain. We also need to take a look at that as well. So you're not just thinking about the knee arthritis, but a bit further up and a bit further down too as well, for the proper management of knee arthritis, as well as lifestyle changes. With any medical condition, lifestyle changes have a role. Knee gel injection. So with the knee gel injection, what that tends to do, that aims to replace what is called the synovial fluid in the knee joint. Everyone is familiar with the cartilage in the knee joint. This here is a model of a knee joint: thigh bone, shin bone, kneecap, ligaments that support the knee. So what you don't see here is something called synovial fluid. Now the synovial fluid is a gel-like fluid that helps with the lubrication and the cushioning and the movement of the knee joint. The cartilage alone helps with that, but it is not the only factor when it comes to the movement of the knee joint. In the picture of arthritis, what tends to happen with the synovial fluid, or that lubricating fluid, it tends to get less in volume, as well as it may become more watery. So what we can do, we can artificially replace that synovial fluid with a gel shot, or what is usually called a hyaluronic acid shot. And it comes in a syringe like this here. As you can see, it's a package in the syringe, and then that gel is injected into the knee joint, and it floods the knee joint, and it helps and replaces the natural synovial fluid that was once there. So with any injection, whether it's steroid, whether it's PRP, whether it's gel, you also recommend lifestyle changes, therapy to strengthen the knee joint. As well, if you're overweight, you have to lose weight. If you have any foot or hip imbalances, you need to also deal with that. Insoles for the feet to help realign the foot, therapy to help to deal with any hip imbalances that may be contributing to the pain of knee arthritis. So that is a knee gel injection there. People always ask about the side effects of the knee gel injection. Unless you have some sort of allergic reaction to the components in the gel, the main side effect would be some temporary pain at the injection site. Knee tends to feel a bit heavy and stiff after injecting it, but after it adapts and then you begin to feel that looseness in the knee. The reason you tend to get that stiffness in the knee, it is that the joint capsule that encapsulates the knee, when you inject that gel, it's going to put a bit of a stretch on that joint capsule, and that's why it's going to feel a bit uncomfortable. But as it adapts and accommodates the gel, you're going to that stiffness or that heaviness sensation in the knee is going to go away, and afterwards it's going to feel comfortable. So the gel that we offer here, it is a gel shot done once every 6 months. In the past, it used to be 3 shots, 1 shot every week. Now we have 1 shot, and at the 6-month marker, you can do another gel shot if you're feeling that pain return. We recommend you do it as a top-up, just be a bit proactive, and once you can afford it, you can do the gel shot once every 6 months. So I hope you enjoyed that. If you want to book a consultation, you can call our WhatsApp 747-5297-308-3370. We are located at number 4 Chincuna Gardens, Chinchin Road in Cunupia.
You can tap the description below for all of our contact information.